morning, everybody. Thank you so much, Mary, for introducing me. Like she said, my name is Judy Hakiel-Calcaterra, and I am a licensed mental health therapist. Okay, so a little bit about me. We'll go over a few things. Like she said, I have a daughter. She's 14 months old. We moved to Davie last year in June. We purchased a home in Forest Ridge. I lived in North Miami for about 7 years as well. My husband came from Coral Springs, and he really hated Miami, and so we moved to Davie. That was the compromise. I'm a Florida state license in September of 2012. I married Paul in 2012 as well. And I'm also on the National Board for Certified Counselors, and I was inducted in May 2010. I have my master's in mental health and rehabilitation from Barry University, and I have a BA in sociology and minors in business and retail from the University of Arizona. I grew up in Rochester, New York, which is way upstate. It's near Buffalo, in between Buffalo and Syracuse. My dad is from Poland, and my mom is from Romania. So there's a couple pictures of us. That's Kayla in the middle at our wedding, and then when she turned 1. So I know she said a bunch of my past jobs, but this is past jobs that I've had in my career. So I worked at Bayview, which is it was a community mental health facility. I pretty much saw anybody who had a chronic mental health illness. So they were diagnosed probably at a very young age, and then they came for medication, and then they came to see me as well, typically once a week. Since then, they have closed down. I was actually laid off in 2011. That's when I went to Spectrum Programs. It was a residential substance abuse facility. My clients typically were coming out of county jail, state prison, and federal prison. They typically were dual diagnosed, and so they had a mental health issue and also a substance abuse issue. They stayed there anywhere from 3 months up to 18 months, and we saw them all the time, so they became my family. I was there Tuesdays through Saturdays. I worked 2 nights a week, and so when I got pregnant, I knew right away that I was not going to stay in that job afterwards. And so in last year, in February, when my daughter was born, I never went back. I have some crazy stories about them. So why am I an effective therapist? I have the ability to listen and convey understanding without judgment. I have the ability to be sensitive, empathetic, and patient. I have a sense of self-awareness and know my own biases and is able to analyze my own feelings. So that's really important. Something that I learned throughout the past, 10 years or so, is that you have to be really comfortable on who you are as a person and what type of client you can see. So one of my classes that I took in my master's program was sex therapy. So we came walking in, and there was a porno being shown. So there was and so we all walked in. We're like, what are we doing here? And so the teacher said, if you're not comfortable, then I ask you to leave. But the reason that she did that was to see how comfortable you are in case if a client ever came to you with any type of issue, a sex addiction, any other type of addiction, if they were lesbian, gay, if they were homophobic, what type of client are you comfortable seeing? And so that was really what the class was all about. So she quickly turned it off because there was men and female in the classroom. She didn't want it to get all awkward. But it's something that you have to be comfortable with on who you can see as a person. If someone came into your office and said, I don't like gays. Well, if I'm gay, which I'm not, but if I'm gay, and someone came to me and approached me like that, how could I see that client? I wouldn't be able to. Or maybe I would. It depends on who the person is. And so that's why she had that going on. We didn't understand. We were like, what are we seeing? And so I'm sensitive to cultural differences, especially down here in South Florida. There's so many different cultures, from Latinos to blacks, different religions. If you're not comfortable with a specific religion, if you had an issue before with them, then you would not be comfortable seeing them. And so that's something that you have to be okay with. If someone came to you and said, I don't like Jews, I'm Jewish. Do I broadcast it? No. But if someone came to me and said, I don't like Jews, would I feel okay seeing that client? I'm not sure. I've had it happen before, and I had to just kind of explore what was the reasoning for it. There's always a reasoning, typically. But I have the ability to model appropriate behaviors. I am ethical. I have a good sense of humor that is not hurtful towards others. I follow the American Counseling Association Guide on Ethical Behavior, so I've never had an issue with my license or anything like that. So reasons for coming to therapy. So there's a big stigma, of course, like only the crazies go to see therapists, or and sometimes that is true. But anybody here can come see me. We have regular people, we have professionals, I have lawyers, doctors, anybody can really come see me. But these are some of the reasons for going to therapy. Balancing, somebody needs help with balancing their life, parenting, career choices, intimacy issues, conflict, relationship problems, money problems, finding out a child has a mental health illness, that's really scary. Any mental health illness that they've just been diagnosed, a chronic illness, grief and loss, somebody just lost somebody, they need some help, some support, anxiety, stress, anger management. I saw a lot of that in residential treatment. A lot of people have anger management problems, right? Divorce and postpartum. So that's, when I started off in the private practice, that's something that I kind of took over, was the postpartum, because I was a new mom. And I did a lot of research for myself and for all my friends as well. And so, and I'll talk a little bit more about my support group that I have. But so those are some of the topics that people come to see me for. So who do I see? I see individuals, I see men, I see women, and I see teenagers. I see couples who are married. I see couples who are not married, so boyfriend, girlfriend, boyfriend, boyfriend, girlfriend, girlfriend, divorced couples, and families. So anybody with children as well. So here are some case examples. So a female client who has 2 children, one was 18 and one was 20. She was married for 20 plus years, and she came to counseling. She said, this was her quote, she said, "My marriage fell to the bottom, and now that we are almost empty nesters, we need to reconnect." So as a mom or as a dad, we place the children typically first once they come about. Well, what happens to the connection between the partners? It typically gets lost. Well, they stay together because of the children. That's typically what I hear. And so now she had no idea who her husband was, and her husband had no idea who she was. And they worked together. So imagine that. So, going on those romantic dates, things like that, that's really important. So that's something that we talk about with communication as well. So I have another client, female client, who has 1 child, aged 10 months. She was unemployed. She lost her job when she was pregnant. She's been married only for 2 years, and these are some of the issues that came about: financial problems, intimacy problems, communication problems. And then she came in because she said, "I don't know if he loves me anymore." So it started off, she came by herself, and then after the 3rd session, her husband came. So what does that say about the husband? Does he love her or not love her? Probably supports her, right? Loves her. So that showed to her, she didn't understand why he was coming. She's like, well, I don't know, I just told him to come. Well, men don't typically come, women don't typically go to counselors unless they love each other. So these are some of the best referrals that you guys can help me with. Any person that you know that has said they would like counseling, of course, if they said, "I need counseling," please give them my card. That's so easy. Any couple you know that may be on the verge of breaking up, that may want to fix some things. Any couple that consistently fights, you probably know those couples. Any teenager that you know that may be struggling with teenage problems. Any new mom dealing with symptoms of postpartum. Any new parents dealing with the challenges of parenting. Parents who are soon to be empty nesters. Anyone you know that may be suffering from an alcohol drug problem. And then any general practitioner, gynecologist, family lawyer, yoga studio, life coach, daycare center, church, temple, bulletin boards, preschool, dance studios, any mom groups that anybody knows. How do you go back? So this is something that I did for a gynecologist office a few weeks ago. I catered lunch to them. I was able to meet with the 1 doctor, 3 nurse practitioners. And so if you guys, like I said in my 10-minute, if you guys know of any offices that you can get the business cards. I can call them and get catered lunch for them, and then I talk about what I do. So I have another one thanks to Maria. She also gave me her doctor's office. And then this is the support group that I have. It's free. Meets the second and fourth Wednesday of every month. So if anybody can post this in their office, they would like to, then I can set it up for them. So once again, my name is Judy, and I am your licensed mental health therapist. Thank you.